All right, good afternoon, everyone, and welcome to our roundtable on the effects of COVID-19 on visible minorities groups in Canada. This initiative has been funded by Edmonton Community Foundation, and in this session, we will investigate issues that have been affecting the lives of community groups in Canada. We are very honored to have Lynn Barr-Telford, Assistant Chief Statistician of the Social Health and Labor Statistics field at Statistics Canada, and Cheryl Whiskeyjack, the Director of Bend Arrow Healing Society, joining our roundtable conversation today. This conversation will explore the social and economic effects of COVID-19 on different ethnocultural communities in Canada. And we will address the following topics during this conversation. So first of all, there's a link between high poverty rates pre-COVID-19 among visible minority groups and the financial impact of the economic shutdown on these groups. The varying rates of job losses or reduced work hours among those employed prior to shutdown, with a higher rate among Filipinos and West Asians, and a stronger impact of the pandemic on visible minorities' abilities to meet financial obligations or even essential needs, taking into account differences in job loss and immigration status, education, and other socioeconomic characteristics. Even though we are not gathered in the same physical space, we would like to acknowledge the land that CFRAC occupies on Treaty 6 territory, traditional homelands for many Indigenous peoples. With this acknowledgement, we pay our respect to the elders past and present who call this land home, and remind all of us gathered here today of the responsibilities we have as treaty people to understand our shared colonial history and work together toward a just future that includes and enriches all peoples. At the Center for Race and Culture, we are trying to go beyond a formal land acknowledgement and connect it to our current socio-political milieu in Canada and consider our parts as individuals, responding to acts of discrimination and moving towards a more inclusive society. Only very recently, news reported Joyce Ekishan disturbing and unacceptable treatment by staff prior to her death in a hospital in Quebec. Joyce's suffering and death is not an isolated incident. The Viens report, which is the result of an inquiry which was launched into allegations of police misconduct against Indigenous women in the province of Quebec, underscored that it is impossible to deny that Indigenous people in Quebec are victims of systemic and institutionalized discrimination in accessing public services, including health services. It is also because of the systemic inequities and discrimination these communities face that Indigenous people suffer disproportionately from COVID-19. For example, many First Nations communities lack access to clean water and inadequate funding for on-reserve housing, which has led to severe overcrowding, making social distancing difficult. In remote northern communities, many nursing stations are ill-equipped and understaffed. Some Indigenous communities also do not have access to the personal protective equipment they need. And this does not even begin to cover the mental health impact these communities will face moving forward. These events and findings point to the importance of acknowledging that these disparities exist in order to challenge them. Since its establishment in 1993, the Center for Race and Culture, formerly known as the Northern Alberta Alliance on Race Relations, has brought together diverse people with an interest in promoting and supporting individual, collective, and systemic change to address discrimination and racism, and to encourage intercultural understanding. Taking an intersectional approach, our expertise spans workplace development, community building, research, and education. If you would like to know more about current events, projects, or activities, please visit our website or sign up for our newsletter. Just a few words about this roundtable series. So this session is part of a new initiative titled Challenging Discrimination Through Community Conversations, and it is an ongoing series of online moderated roundtables and webinars with guest speakers from diverse communities, organizations, academia, and the general public. We seek to understand and address experiences of discrimination and exclusion in the Canadian context. By shining the spotlight on different forms of discrimination, such as anti-Black racism, anti-Indigenous racism, or discrimination against Asian communities, just amongst other topics, we hope to encourage solidarity among groups and individuals interested in promoting social inclusion and equity. This is a community-based initiative, and we welcome any ideas or suggestions for collaboration. So we would really appreciate if you could reach out to my colleague Mansouri or myself if you would like to be part of a future conversation. And you can also use the feedback form, which we will share with you during this event, to provide us with your thoughts or questions. Now, I have the great honor to introduce our speakers today. So first of all, Cheryl, we are very happy to have you here today. Cheryl Whiskeyjack is the Executive Director of Bend Arrow Traditional Healing Society, and her job is to help urban Aboriginal peoples live in two worlds at once: the city of Edmonton with its particular laws and norms, and the Aboriginal world of ceremonies and beliefs that has existed on this land for millennia. Those two worlds can live in harmony, but it isn't always easy. We have a community of people who are thousands of years from this land that we are on right now, Cheryl says, and they don't feel connected to it. They feel displaced, even though they live here. So public engagement is a way to re-engage the folks that we serve. Cheryl has been with Bend Arrow just about since its inception, a quarter of a century ago. And now she oversees a suite of 18 different programs and services. The organization's programming connects Indigenous clients to the city around them and helps them build skills and resilience that they can use in other parts of their lives. People are sitting straighter in their chairs by the time they're done in their program, Cheryl says. Our other speaker is Lynn Barr-Telford. We are very happy to have you today as well. Lynn is the Assistant Chief Statistician of the Social Health and Labor Statistics field at Statistics Canada. She holds a master's degree in sociology from Carleton University and has several years of experience as a senior executive with responsibility for large, complex statistical programs. The social health and labor statistics field provides accurate, timely, and relevant information across a range of social subject matters to decision makers at all levels of government, non-governmental organizations, researchers, and the Canadian public. The portfolio includes a number of large survey and administrative data programs, such as the Centre for Population Health Data, the Canadian Centre for Justice Statistics, the Centre for Gender Diversity and Inclusion, and the Centre for Labor Market Information. Just a couple of words about myself. Sorry, my apologies. I'm the current research coordinator at the Center for Race and Culture, and I'm currently working on the Understanding Newcomer Experiences of Inclusion research project. A final report of the outcomes of this project will be made available to the public by early 2021. I'm currently completing my PhD degree at Concordia University in Montreal in history and anthropology with a focus on difficult heritage, specifically the Holocaust in the German context, public memory, and curatorial interventions. I have a strong interest in how societies and individuals deal with historical trauma such as racism, discrimination, persecution, and genocide, and how such memories are silenced, re-emerge, and made visible in society. I completed my BA and Master's in Cultural Anthropology at the University of Victoria, and I also have a graduate professional certificate in Cultural Heritage Studies. I have been a docent at the Vancouver Holocaust Education Center as well as at the Montreal Holocaust Museum, and I have over 10 years experience in conducting community-based research as well as a facilitator and as an educator. So now we will move on to our conversation and we will pose the first question to Cheryl. Cheryl, based on your professional experience in community engagement, what is the significance of gathering data and talking about these current issues in our community?
Okay, so one of the latest things that I've been involved with in the last year is I was able to gain a seat on the National Council on Poverty Reduction, which is a federal appointment. And one of our deliverables is to report on Canada's poverty reduction strategy. And we are 10 members from all over Canada. Almost every province and territory is represented on our panel. There was, I think, about over 800 applicants, and they had to pick 10. So I was one of the lucky ones that was able to gain a seat on this panel. And we started our work by looking at poverty, just full out poverty. What are the factors? What are the things that we need to pay attention to? What contributes to it? What perpetuates it? All of that kind of stuff. And very wonderful, knowledgeable, diverse folks that are on this panel with me. And it was really interesting to hear the perspectives that they bring to the table, and a lot of common ground we could find when we were starting our conversation. This would have been in the fall of 2019. Our plan in the new year was to do a community engagement across the country. We started in BC at the beginning of March, and we only made it to Winnipeg. In a couple of weeks, we made it to Winnipeg and Yellowknife, and then COVID hit. And one of the things that happened in that is that we, of course, our engagement stopped. But the next thing that happened was all of the implications from COVID started to hit the communities that we were trying to get to talk to. And so what ended up happening with our council was we became the voices of what was happening on the ground in our respective territories, and sharing the up to the minute information of what was happening in our communities with the ministers, so that the minister could talk to our prime minister, and some of the things that emerged from that. It was really pretty cool to see a conversation we had on Monday turn into an actual government benefit by Wednesday. So the federal government was very quick to respond to lots of the issues that we were bringing to the minister's ear. As we, and then of course we were planning on meeting quarterly, but because COVID hit, we decided we needed to meet more frequently. And so we used this as a platform, as many people did. And in using that platform, we were able to have way more conversation with each other, because we stayed where we were and talked about, again, what was happening on the ground and some of the things we were learning as COVID started to progress. And the importance of data came in because we knew that there were certain marginalized groups that were experiencing COVID very differently than other populations. And data became very important in the response of municipalities, the response of provinces, and the response of our federal government in how do we support the needs of our citizens across the land, so that we could, as best as we can, try to minimize the impacts of COVID from a financial standpoint, from a health standpoint, from like all different areas of a person's life. And data became really important. Because we were a diverse panel, we had representation from the Indigenous community. We had representation from the Black community. We also had representation from rural and from urban. And we're able to bring all those perspectives together to look at what were some of the issues that folks were experiencing, from domestic violence, mental health, access to technology, food security, all of the things that we know and have heard of since COVID began are areas that we were putting focus on. And also in the hotspots in the country, where COVID was seeming to infect more people than others, we were able to attribute that to denser household populations. So populations where you had probably more than one generation cohabitating in the same house. And those were typically happening in neighborhoods where there was a lot of social housing happening. And so they were concentrated in certain neighborhoods is one of the other things that we're learning. So data became really important in the response, but it became also really important in finding out where to target some of the interventions that we saw happening as COVID began to progress and as we began to learn more. I think that's enough for now. But yeah,
That was very, very interesting. Thank you so much, Cheryl. Lynn, do you want to respond to that?
Well, Cheryl, thank you so much for sharing your experience and for really putting the importance around the data and the use of the data and how it plays a fundamental role for communities, for decision makers in documenting what is happening on the ground. I think that is really so fundamentally important to hear of the involvement and the engagement of various communities in the data process. Good data comes from that kind of engagement and that kind of relevance, and making sure that what is gathered and collected resonates, makes sense, and really importantly, informs the ongoing dialogue. So I thank you so much for sharing that experience of yours.
Mm-hmm.
Lynn, can you speak a little bit to the data that you and your team have recently collected? So you've looked at certain subgroups in our society, and can you speak to your findings perhaps a little bit?
Thank you for that. I can. At the outset, I think it's important to say that at Statistics Canada, we have a long history in documenting and in telling the story, the diversity story of the Canadian population. Over 150 years, in fact, of telling those stories through data. So COVID-19 is a very specific context, and the importance of being able to continue to tell the story and to measure the impact of the pandemic is really very, very important to us at Statistics Canada. One of the key contexts that I think we all face is the recognition that COVID-19 itself has really shone a light on the inequities in Canadian society that predate COVID, and also at the same time shone a light on some of the existing data gaps that we have for diverse groups in communities across the country. And so as a statistical agency, given the need, as Cheryl has so eloquently articulated, for that kind of information, we embarked upon some innovative data collection strategies. One of those was what we call crowdsourcing. So this is where we invited Canadians to visit our website and answer some online questionnaires and really targeted across various aspects of their COVID-19 experience. Crowdsourcing is not a statistically reliable kind of methodology, but what it is a mechanism to provide rapid information for a large group of participants, and that in and of itself has value. So some of the different areas that we explored with participants, with Canadians, were mental health, experiences of discrimination, experiences with respect to harassment, and feelings of personal safety, as well as getting a sense from Canadians of various groups on what the financial implications they were feeling throughout the COVID-19 pandemic. So I like to think of it as our being able to have a conversation with Canadians from diverse groups about their various experiences and learning from those conversations. So what are some of the things that we found? Almost across the board, whether it was mental health or the financial implications of COVID-19 or experiences of harassment and differences in personal safety, clearly the information was showing that COVID-19 is not having an equal impact across all groups within the Canadian context. Various diverse groups are feeling the effects of the COVID-19 pandemic differently. So let me give you a sense let's talk for just a minute about mental health, for example. So when we received some information from groups who are designated as visible minorities in Canada, we found that they self-reported poor mental health outcomes than white participants, for example. A higher percentage of our visible minority groups self-reported fair or poor mental health, for example, and were more likely to report symptoms associated with generalized anxiety as another example. Yeah. And for our Indigenous crowdsourced participants, we learned that for about 60% of these participants, they told us that their mental health had changed since physical distancing began and had worsened over that period of time. So regardless of what it was we were looking at, we were seeing the unequal impacts of the pandemic across diverse communities.
That is very interesting. Thank you so much for that information, Cheryl. Sorry, my apologies, Lynn. Cheryl, can you speak a little bit to the impact on the community's mental health, specifically the impacts of finances, for example, the impact of discrimination and so on?
Sure, happy to. We're a very relational community. And so we like being together and like sort of relating to each other in person. And so retreating into our bubbles really had a profound impact on a lot of the people that we serve over here at Bentero. I'll just tell the story real quickly about one of our participants who actually came to us as a, it was still his choice, but it was, he was recently released from a correctional facility. And in order to give him a better chance to stay out of that correctional facility, the police actually wanted to connect him with a community organization like ours, in hopes that he would take root in our community and that would reduce the chances for recidivism for him. And he didn't feel like it was a choice. He felt like the police were directing him to be here. And so he sort of approached it in that spirit. And when we were doing the intake with him, it's a service we have here called New in Town, and it's a service for Indigenous newcomers into the city, and it's about helping them make that transition in a good way. And we also work with the Edmonton City Police in that work, because we know that a lot of people get released from correctional facilities with a host of conditions that are really difficult to meet, because they often say things like, you can't hang around these people, which are the only people in their circle, and you can't live in this part of town, which is where they happen to live. So they're highly at risk of breaching conditions just by getting released. So this individual was brought to us, and he was very intimidating looking. He had tattoos all over his body. He looked very physically bulky, and he was very intimidating looking. And the police officer that had a relationship with him had to leave the room to take a call. And as soon as he left the room, he said to our New in Town staff, "Do I scare you?" And our New in Town staff said, "Should I be scared?" And as soon as that response was given to him, he immediately realized that, like, I scare people if I want to scare people, and these people want to help me, and so I'm going to sort of give them a chance. He took root in that opportunity and came to Bentero every day, even if he had no business to conduct. He just needed it as a sort of touchstone every day to remind him of why he was living the way he was living and how to stay on that path. And then COVID hit, and it was really unfortunate because he had to retreat in a bubble, as we all did, and it became very easy for old ways to come back because he didn't have that touchstone to to connect with every day. He physically assaulted his partner. He ended up going back into jail. And because they couldn't charge him, because she wouldn't charge him, they ended up having to release him. And it was just really awful watching this man spiral. He actually passed away a few weeks ago, and we were all so deeply affected by his passing, because we really strongly believe that if he had stayed connected in the way he was connected before COVID, that his path would have looked very different. And so that's just an example of how important relations are in our community, and being able to connect with people who are on a path similar to yours, and how easy it is to get derailed off that path if you're not connected. Our seniors were another example. They became shut-ins. Many of them live with their families, and we were receiving very concerning reports from some of our seniors about senior abuse, and how they were being financially exploited by people in their family, and just feeling very isolated. And so access to technology became very important for us to connect with our seniors, and we were able to go online, for example, and do FaceTime, which they think is just like, you know, from Star Trek or something, and also sort of do bingos online and do all kinds of things that get them connected to each other and connected to the outside world. So like mental health was one of the very first things we saw definitely get affected. Finances, of course, were another thing that got affected. Food security. When you have like 3, 4, 5 children at home, and they are a part of a hot lunch program at school, now they're at home 7 days a week. It quickly hit the bottom line of families' food budgets when they had all of their children home 7 days a week. And so the need to connect people with resources around food security, like it was just like it was just a cascading issues that popped up from us having to retreat into our own little bubbles.
Right. Thank you for sharing that, Cheryl. I'd just like to follow up, because earlier on you said that one of the purposes of your organization is to help Indigenous people who live here in Edmonton to connect with the part of Edmonton that they can also feel at home with.
Yes.
And do you feel that now with the COVID, that disconnect is perhaps even larger?
Yes, absolutely. And so one of the ways we try and sort of deal with that, Miriam, is we work very hard with other organizations to come at approaching Indigenous people in a similar way to us. So to become very relational with them, to have some root and basis about knowledge, culture, kinship, worldview, all of that kind of stuff, so that when they start a conversation with someone from our community, it is something similar to what they'd be used to hearing from our organization. And so having our ability to connect with our community definitely was a disruption, but also being disconnected from our colleagues and community, and being really focused on COVID. So instead of relational conversations with our colleagues and community about how to engage, it became all about COVID. Like all of our conversations became about COVID. So, and rightfully so, like we needed to respond fairly quickly to some of the needs that were emerging, but it also derailed that conversation about engagement for sure.
Yeah, yeah. I'd like to ask both of you, Lynn and Cheryl, what do you think needs to happen on a larger scale in terms of governmental organizations and policymaking to move forward towards a more equitable action plan? Of course, this is very complex, and this is not an easy, straightforward thing to suggest, but clearly with what we are seeing now from the data from Stats Canada, and also Cheryl, what you're speaking to, there clearly is a need for the government to move forward. Can you speak to that a little bit? Perhaps, Lynn, if you wanted to start?
Thank you very much. One of the key messages among many that I heard in Cheryl's story was the interconnectedness of all the various aspects that our day-to-day lives have been touched by COVID-19. So when we think about the direct health impacts of COVID-19, that's one thing. But what we're talking about in many ways is the impact across so many domains of everyday life. And Cheryl has pointed to a number of those. So I think about, and we've measured these impacts across multiple domains, and that's what's so fundamentally important in my message. Think about parents who this September are getting their children ready to go back to school. Very different experience than it was a year ago today, with virtual, online, and combinations. We've spoken about mental health and the consequences of COVID-19 on mental health. Our recent labor market results that we released in August really point to the unequal impact that COVID-19 has had in the labor market, for example, on low-wage workers, on Canadians from visible minority populations as examples. And when we put all of this fabric together, it does speak to that complexity. So what we're really talking about is an integrated picture on the impacts of COVID-19 and how we have to keep that in mind, that yes, absolutely, we are dealing with a pandemic. We are also dealing with the indirect consequences of that pandemic, and it spans so many dimensions of our everyday life.
Yeah, thank you, Lynn. Cheryl, would you like to reply to that as well?
Yeah, I actually was writing lots of notes, just even as we've been talking since we started this, and in the wonderful conversations we had with the National Council on Poverty Reduction, we have a report that we have to deliver to our minister that appointed us, and one of the things that we talked about, speaking of Statistics Canada, we had a lot of support from Statistics Canada in helping us sort of paint a picture of what poverty looks like in Canada and how COVID impacted that picture. And we also talked about the need for more data. So the data we have tells a story, obviously, but you can look at data from many different angles, as we all know, and you can't always get all the answers that you're looking for by looking at the data that we're presently correcting. So we actually are trying to look at making recommendations to StatsCan around aspirational data. We're calling it aspirational data right now. And so it's things where we wondered this, and by looking at the data that StatsCan is collecting, we aren't able to get a real clear picture on this issue or that issue. And so we're really working hard to sort of think of ways that, or not think of ways, because that's what StatsCan would do, but talk about the gaps that we're noticing in the data and what kind of data story it would tell if we were able to gather data around a certain issue. The other thing that has come up is on this council, one of the things that I am really loving about being there is I'm not the face and spokesperson for all things Indigenous just because I'm on this council. That we have some really exceptionally knowledgeable people from all over the country that are on this, that are working with people in the Indigenous community. And I can say this is what the experience is, and they can actually validate that experience from their context, from their part of the country. And having that be validated by a Black scholar from Toronto, who I see that a lot. One of our council members is a scholar from Toronto, and to have him say, you know, with a very strong voice that this is an issue and it needs to be addressed, speaks way more than me saying the same thing. It's easy to sort of say, well, you know, of course you're going to say that because you're from that community. But to have someone from not that community say the very same thing. So I guess what I'm talking about is holding each other up and holding each other accountable for some of the things that we're seeing. And COVID-19 didn't just highlight things around poverty and mental health, it highlighted things around racism, as we know, issues with police. So many things came up during this time and continue to come up, as you mentioned, Miriam, with Joyce Echequan in Quebec. The other thing that we watched with held breath here in Alberta was seeing the feds dedicate large amounts of resources to the provinces for a certain specific purpose. I'll use education as an example. So the provinces were all given this money around supporting re-entry for kids in school. And we waited with bated breath here in Alberta about what is our province going to do with that money, and how equitable was going to be its distribution, how sensical was it going to be, right? Not even just equitable, but did it make sense how they were going to distribute it? And so the question came from our council when we looked at how it was done across the provinces is there a way the feds can sort of be specific in those transfers to say, this is what we want it for, and this is the criteria you must meet when you use these dollars? Would perhaps result in something that would be more sensical and equitable for the purposes that it was put aside for. The other thing that I always like to talk about, well, that we talked about as a council is we saw our, during the time of being on our council, we actually went through a federal election. And so our mandate stayed the same. The country went through an election process, and the same government stayed in place, but we wondered what would happen if the government changed. Would our council change? And so it brings to mind, when we're looking at big issues like this, it needs to go sort of beyond the term of the party in power. And so we need to sort of look past that. And often what our governments do is they don't look any further than the own term that they're there. So we need to start looking at that. And then finally, I'm really on Twitter a lot. And so I see that as a medium to sort of educate and to have some conversations with people across Canada, across my city, across my province, and across the country around some of the things that are going on. And I really am mindful about how I engage in those conversations, because if it becomes too serious and too hard, people disengage. And so I need to be very mindful when I'm engaging with people on that platform that it is in a way that we can keep the dialogue going, because it's really important. We're the ones who elect the people in power, right? And so if we learn something as we go, maybe we look for those priorities in the leaders that we choose. So those are just some of the things that I think about.
Okay, thank you. Lynn, what are your thoughts on in terms of going forward, what has to change on a broader level, considering the disparities that are now really coming to the surface as a result of the pandemic and the economic difficulties we are currently facing?
Cheryl noted an important, really key point for me that resonated around data gaps. And to Cheryl's point, these are not new data gaps. These are data gaps that have existed for a while. And clearly, COVID has shone the light on these gaps and has really brought into focus the need for more disaggregated data within this country. So as a statistical agency, we've done a number of innovative things over the course of the last several months, whether it's crowdsourcing, adding content to some of our big flagship surveys like our labor force survey, introducing web panels where we explore some of the impacts of COVID-19 with a statistically representative group of Canadians, or our crowdsourcing that I was referring to. But going forward, in order to be able to address some of these data gaps in a sustainable way, and that's what I heard from Cheryl as well, is sustainability of the effort. It's going to take more than only a national statistical agency to make that happen and have that sustainability going forward. That's why the partnership with communities is so fundamentally important. The engagement with key players. Cheryl talked about the role she has played and others in dialogues around poverty and poverty measurement and so forth. Really important to have that interplay of partnerships across various communities and engagement across various communities. So to have that longer term impact, the collaboration among organizations, the collaboration across different jurisdictions, and the opportunity to be able to collect this information in a standardized, trusted way, I think is going to be key if we're going to sustain a longer term strategy that helps us to fill some of these data gaps, particularly when it comes to disaggregation for diverse groups of Canadians at community levels where, as Cheryl has really shown us today, where action really matters and the experience is lived.
Yeah. Thank you, Lynn. Lynn, what are your thoughts around how will Stats Canada be able to move forward as they measure the data? So what Cheryl referred to earlier on the anticipated data, because what we are seeing here with the COVID now is completely unprecedented, and we are learning new things as it happens, and we cannot possibly even estimate the full impact in all aspects of life that the pandemic has had. How is Stats Canada going to move forward by also anticipating certain trends that may possibly emerge?
Thank you for that question, Miriam. It's an important one because measuring the impacts of COVID-19 will extend into the future, as I think we all recognize, particularly given the intersectorial or the intersection of all the various elements that this pandemic has touched. So we have, for example, introduced some new content to our labor force survey. So as of July, for example, we're able to track the labor market impact on diverse groups, population groups within the Canadian context. That's something that we will continue to do moving forward. We also know that the census is the foundation of much of the work done in this country on understanding the Canadian population, and we have a census coming up in 2021. So that will be an important vehicle for us in understanding. We have a number of different mechanisms that we're looking at to help us look and measure the impact of COVID-19 going forward. Even our current work around poverty measurement and so forth is really focused on how do we get more disaggregation with bigger sample sizes so that we can chart for diverse groups of Canadians the impacts of COVID. And in our health context, we as well are measuring right now some of Canadians' experiences in the COVID-19 context, and we're going to need to look to the future on how we do that. But I do want to come back to that key point that I made. This will take a community and a collaborative effort among many players, not only us as a national statistical agency, but the work of members of the community like Cheryl and others who really truly have pointed to the need for this information.
Cheryl, I imagine with the pandemic and all these unprecedented issues and challenges that are arising, I imagine that also puts a specific challenge to your community organization to try to anticipate some of this and also to respond. And of course, this is also all happening very fast as we are speaking. What has your experience been with your community organization to adjust to these new challenges and demands? Cheryl?
Yes.
Oh, sorry.
Yeah, I always try to remember to unmute myself. We actually adjusted fairly quickly. I think the biggest adjustment we had to make was being able to have the technology available to us and to our practitioners to be able to connect with our community. When the federal grants were dispersed fairly quickly, we quickly made because urban Indigenous people were included on many of those COVID grant opportunities, we applied because we're an urban Indigenous organization, and we were able to get funding. And one of the very first things that we did with that funding was we gave access to our community to technology. So we had technology. It was pretty easy for us to retreat into our bubbles and be able to connect with each other, but we weren't as easily able to connect with our community. And so we used a really big chunk of our emergency COVID grant to purchase tech for our community. One of the real inequities that I saw in that process was we do a lot of work with child welfare. And because our children are funded through that system, we saw our child welfare system fund our children with technology, but the parents that they have and that they're connected to didn't have access to that same kind of support. And so these kids had technology, but to connect to who? To connect to us as their worker, I suppose, but didn't have a connection to their home community and the people in their home community. And so when we quickly focused our attention to get tech to families, we were able to keep those connections going with kids and their people and their grandparents, their aunties, their parents, their moms, their dads, and their siblings and so forth. So the adjustment happened fairly quickly, and we were able also to use technology to do our group activities through virtual means. And so I always tell the story about, I don't know if anybody's seen Big Bang Theory with Sheldon and Amy doing fun with flags and how sort of stilted and awkward they are in doing it. Our earliest broadcasts were like that. They were pretty stiff, and we were unsure of how to use the platform. But now when you look at some of the virtual broadcasts that we're doing that are connecting families with activities and teachings and all of those things, they're really well done. Like, I'm really impressed with how quickly our staff adapted to doing things in this way. And we will connect our community with the supplies that they need to participate in the activity that we're having. So if we're going to make cornucopias for fall, you know, because Thanksgiving is coming, our staff will go and deliver everything that our families need to participate in that activity. And then our host will be on TV, on Facebook Live, saying, here's what you're going to need, you know, get these things ready. And then they make these things together. And it doesn't have to become about, well, we don't have those things, so we can't participate in the activity. We make sure that they can connect. So we actually adapted fairly quickly. And I think the reason we did is because we are a very relational community. We need to connect in this way. Connecting in this way is not going to be enough of a connection for us to be that connected. So.
Right, yeah, thank you. I have a question for both of you, and it goes back to the disconnect that we were talking about earlier, Cheryl, with, for example, the Indigenous community who lives in Edmonton but does not really feel connected to the city. And I'm wondering also with other subgroups of the population, so for example, the newcomer community or other ethnocultural communities, experiences are very different for different social groups during the COVID. So whereas some folks now work from home and have to deal with that social isolation, that's a whole other level of stress and struggle, say, than not being able to afford food or not being able to even practice proper hand hygiene out of not having access to clean water. Do you feel that this experience with the COVID drives these different communities with their very different experiences further apart? Or do you feel perhaps there's a potential here for acts of solidarity?
I think it's a little bit of both, actually. So as things started to lift and reentry started to happen, we started to see people gathering again. And on the sort of downside of being able to do that, it opened the door for infection to spread because we sort of got a little too lax in some certain areas. So like that's one of the things that we're starting to see is that we're having to remind people in our communities to continue to be vigilant, to continue to be careful, and really explore ways to remain connected, but without raising the risk of infection within their communities. And it is really difficult for a relational community, which newcomer communities typically are as well, to go from being a very sort of connected and close social sort of circle kind of community to bumping elbows or bumping feet, gathering at a distance. It's just not something you do. I think just in relationship to our elders, for example, like we have a real special relationship with our elders in both the newcomer community and in the Indigenous community. And we also know that our elders are really susceptible and really at risk when it comes to this virus. And so it becomes a problem of going against your sort of social norms to keep these people who you consider to be precious safe, which is very, very difficult to do. And it's something that is really hard sort of to mindfully navigate on a daily basis, but we have to do it. So,
yeah. Thank you, Cheryl. Lynn, do you want to speak perhaps to, because you were looking with your data at so many different subgroups, so many different minority groups that are affected. Do you feel with some of the parallels that are emerging in terms of how visible minorities, for instance, are affected, is there a potential perhaps that could enhance solidarity?
I think one of the most important dialogues that we had of late with Canadians was around experiences with discrimination. So one of our most recent crowdsourcing that we conducted asked Canadians whether or not they had experienced discrimination or had felt they were treated unfairly during the pandemic. And the importance of having this information was not only that it documented clearly that diverse groups within Canada are experiencing discrimination differently. So members of visible minority populations, for example, more likely, as well as our Indigenous participants. But the importance of this when we looked at the impact on sense of belonging to communities. When our participants told us that they had experienced being treated unfairly or an experience with discrimination, they were more likely to feel a weak connection with the community. So I think that these are really important aspects to consider on how community dynamics, the way in which we interact with one another in society, impact other aspects. We also saw it had an impact, for example, on Canadians' trust in institutions. For those who had experienced discrimination, had not been treated fairly, there was greater tendency for higher levels of mistrust, if you will, in institutions. So these have impacts on community belonging, and they have impacts on the nature of how communities interact. And for me, this was an important aspect to explore in some of the work that we've been doing to try and assess the impacts that various communities are feeling given the COVID-19 context. And I think we all acknowledge that this has been a very important dialogue in our context and in others as well.
Okay, thank you. This is a question really for both of you, considering the complexity of the issue with COVID and inequity and racism. it's easy to talk about the large system changes that need to take place, but how about the individuals out there in the community? What can we do as individuals who may not have a lot of interaction or engagement with some of these smaller community groups we were talking about? What can we do? Who wants to go first? I'll leave it up to you.
I was just trying to unmute myself again. I think one of the things that we started to see here in our community was just like being part of the conversation. And we saw an opportunity to communicate with regular Edmontonians around what was going on during COVID and what do you think about this and what do you think about that? I think about things like basic income. For all. And so how CERB sort of became that, that mechanism for us to ensure that everybody was taken care of in some way, sort of on an equal basis across the land, and what kind of impact that had for them to continue to participate in the economy, and all of those things. And so that generated a lot of discussion, I found, in the community around one of the things that CERB did was it put a lot of people sort of, maybe not on total equal ground, but with loss of jobs and loss of income, put sort of regular people in the same boat as people who were already challenged with income security. And so it got them thinking about income insecurity in a very different way. And it became a real opportunity for us to have a conversation around that, around what that means for you to meaningfully participate in our economy and society, and how income is really tied to that. And so we heard before COVID that this is just not possible, that we can't go down this road. And then we saw CERB roll out like within days, you know, very quickly. The federal government responded with the need to keep people participating in the economy as we went through the pandemic. And so that's one of the things that I think people can do, is sort of take part in conversations, share also in what their experiences are, things like that, and just be a part of the conversation, talk to your MLAs, talk to your MPs, and do those kinds of things. I didn't know, Lynn, about these crowd sourcing things that you were talking about, but those are also opportunities to have your voice heard and share what your experiences and learn from the experiences of others.
Thank you, Cheryl. Lynn, do you want to speak to that as well?
I would like to pick up on that. And Cheryl, being part of the conversation, as you have articulated, is a way of engaging in information provision. So our data comes from Canadians for the most part, whether it's crowdsourcing or it's participation in surveys or it's engagement in the upcoming census. We owe a significant debt of gratitude to Canadians who continue to share and be part of the conversation through our data collection initiatives, even in really difficult times. These are difficult times for Canadians. We have had thousands of Canadians continue to be part of the conversation through participating in data collection. And without that, we would not be able to talk today about what we've learned, about some of the considerations, and to measure the impacts that COVID-19 is having on Canadians. So being part of that data conversation is a very important aspect going forward. So I really wanted to just give a shout out to all of those who continue to engage with us. Thank you.
Thank you so much. Yeah, so we will be moving on to our Q&A questions. And before we do that, we actually would like to do a quick poll. And we are collecting this data completely anonymously. It goes along also with collecting race-based data and demographic data in Canada. And so we would like to ask our participants to please participate in the poll, because we will also be using the results of this data to effectively inform our future roundtable conversations. So we would be really very grateful if you could please quickly participate. And we would also like to encourage our participants at the end to please access our feedback form, and we will provide the link for you in the chat box also as we go into the Q&A. So I'll give everybody just a couple of minutes to fill out the poll questions. Okay, so I think it looks like everybody is done. Okay, and I will then move on to the questions that came in while we were having the conversation. So the first question I have, and please Lynn or Cheryl, feel free to just jump in if you would like to answer. So the question says, a lot of funding went towards assisting food banks. Two questions. How do you feel the food bank funding will support poverty reduction? Our small mid-sized community and other communities reported a decrease in food bank demand. Do you think CERB as a basic income would reduce the need for food bank usage?
So I'll sort of anecdotally talk about the experience we had. So for our families, it wasn't necessarily about, well, the food was important, of course. But in the early days of the pandemic, it was about putting you and your children at risk to get the food. That was the bigger issue. And so I don't know if that was the reason why there was a reduction in accessing the food bank, was the idea of sort of getting you and your children on a public transportation, putting yourself potentially at risk to get a food hamper, and perhaps staying at home was the safer option. But when we started our food hamper program, there were two things that we wanted to focus on. One was fresh food, which sometimes, depending on what's going on, can be an issue with food bank hampers. So we wanted to focus on fresh foods. And we also placed a really high focus on being able to deliver those hampers to families, so they weren't faced with the choice of putting themselves at risk to get access to it. So that was certainly our experience. I'm really careful and grateful to the food bank, because they play a really important role in helping a lot of the families that we serve. And the way I'll speak about them and the need for them is that when we're looking at poverty reduction, we're gonna need two systems for a period of time. There is no way to say from this day forward, we will have no more food banks, we'll do this instead. We'll need to do a bit of both until some tipping point happens, and the need for resources like that sort of comes to an end. Lynn talked about communities coming together, and we're seeing that in pockets here in Edmonton, which I think is really cool. I get messages from people in our community here in Parkdale, Cromdale, about sending a call out to everyone who has an apple tree, because this company will turn those apples into cider and send it back out into the community. So when we think about being community minded, to me, that's a real wonderful example of taking resources that we already have in the community, being able to do something with them, and then get them back into the people who, instead of those apples falling to the ground and rotting, right? Community gardens, like all of these things are just mechanisms, but the food bank, we need it. Like, full stop, we need it. Things, they pivoted just like everybody else.
Yeah. And do you feel, Cheryl, specifically also with respect to CERB, do you feel with view to the Indigenous communities, would that perhaps also contribute to reduce people's need to even use the food bank?
It's a good question. I'm not at all sure. We didn't gather data around that. So around how often people were accessing the food bank, even if they were on CERB. So it is a really good question. I'm not sure what the answer is, to tell you the truth. I do know that we had a food program and it grew as the pandemic lengthened. So we started out with just under 100 families, and now we're approaching 200 families. So once word got out, more people came forward. So
yeah. Thank you. Lynn, would you like to speak to this as well?
Thank you. Food insecurity was one of the issues that we did explore through one of our web panels. As we know, COVID-19 brought financial instability to Canadians, job losses, hours of work lost, and a number of considerations that really impacted the day-to-day ability of Canadians to be able to be in food secure situations. So we wanted to get some numbers and measure what Canadians told us about the situation of food insecurity during the pandemic. And what we found was that almost 1 in 7 Canadians during the week that we measured told us that in the past 30 days, they had experienced food insecurity. And when we talk about food insecurity, we're really talking about things like food not lasting before there's enough money to replace it, for example, going hungry because there wasn't enough money to purchase food, and a number of other similar kind of measures, if you will. And then we took a look at what we knew before COVID-19. And while not perfect in its comparison, we do ask in one of our major health surveys about Canadians' experiences with food insecurity. And back in 2017, 2018, about 10.5% of Canadians told us they were experiencing food insecurity. So if you compare that to the 1 in 7, about 14.6% during the pandemic, it signals another impact that of COVID-19 that is certainly not necessarily what one would say the direct health impact of the pandemic, but certainly one of those indirect impacts of a pandemic hitting across multiple sectors of our day-to-day lives.
Thank you, Lynn. We had another question that came in, and this is actually for you directly, Lynn. I belong to the community most affected according to your stats. Do you think the data collected could form the basis for addressing the disparity? Should we be forming a community dynamic to intensify employment or education training platforms?
Thank you for asking the question, and thank you very much for sharing your experience. I think that good decisions are rooted in good evidence and good data. So one of our goals at Statistics Canada is to provide that picture, that trusted picture of what's happening in the Canadian context, so that those who make decisions, whether it be at the community level or at the government level across multiple different contexts, have those pieces of information that you really need to understand where are the concerns, where are the possibilities for action, what do we know, what have we learned, what's changed, and so forth. So data is only one tool in the toolkit that decision makers use, but it is one very important tool. I am biased, of course, and I will say that as a statistical person, but it is an important tool in that toolkit. So I do think that the data, trusted data, is key.
Thank you, Lynn. Cheryl, would you like to speak to this as well?
Oh, I think she covered it.
I'm just looking at the chat here. So for our audience, please, if you have any more questions you would like to address to either Cheryl or Lynn, please feel free to go ahead and join or post them in the chat. And we would also like to invite you again to fill out our feedback form. So if you go to your chat box, you will see that there's a link to a Google Doc, and we would really like to have your feedback because it will also help us to design our future conversation roundtables. Cheryl or Lynn, is there perhaps anything else that you would like to add to this conversation that we haven't touched on so far, but that you feel is important to consider in the context of the topic that we had today? Okay, here we have a good question. How might the data inform programming and government policies?
Well, I think I mentioned earlier the opportunity to be on that council and be able to have the ear of the minister who has the ear of the prime minister was pretty heady stuff. Like I'm not saying everything we said turned into some kind of policy or benefit, but it was a two-way street. So we were certainly sharing what we were seeing and hearing in our communities from our various regions. But the other thing that happened as the pandemic went along was the minister came back to us to say, please tell me more about this, please tell me more about that, because I want to inform the prime minister on what's happening in this area or that area. So, you know, just that opportunity, I think, was pretty exciting for me to be able to have some impact on some of the things that we saw happen over the time, and real people's immediate experiences, and have them heard by people in leadership so that action could be taken very quickly. That was pretty cool.
Yeah. Thank you. Lynn, what are your thoughts on how the data that you're generating, for instance, with your statistics, how that will inform programming and government policies going forward?
The data is really key to documenting and to tracking and monitoring and to assessing impacts. There is no doubt about that. It is one tool in the toolkit that decision makers use. It's not the only, but it is one important tool. As a concrete example of that, over the course of the last several months since the pandemic really hit and we went into an induced economic shutdown back in March, if we all think back to that, we've been able to track the impact on the labor market. So with our labor force survey, for example, we've been able to document in what industries there were job losses, among which populations felt the most job losses, where were those job losses felt most. And this type of information is key for those who are making decisions on the types of programs, policies, and so forth that they may want to put in place to address some of these areas. So I think that's one very concrete example of how important it is to have good information. The other area that is important is to understand the impacts on Canadians in day-to-day life. We've talked a lot about that today, about various aspects of Canadians' lives that have been impacted now and going forward, how we'll measure that, how we'll keep track of that. So when we think back to where we started this conversation on mental health as one good example of tracking the impacts of the pandemic across a number of different dimensions, I think it points to the importance of having these data for good decision making.
Okay, thank you, Lynn. I would also like to follow up on, Lynn, just some of the statistical findings you had. And I took a note here that the rates of Filipino and West Asians were particularly high with regard to also job losses. Could you elaborate on that a little bit, what your findings were with that, and why those communities specifically?
Thank you, Miriam, for that question. Back in July, we added a question to our labor force survey asking Canadians to self-identify as a member of diverse population groups. And by doing that, we're now able to generate information on employment and unemployment and changes in the labor market for diverse populations. And we've had a couple of months now of being able to generate the information. So it is early in the data collection cycle to be able to talk about too many specifics, but what we have clearly seen, as you have displayed on a very nice slide, I might add, the results from that labor force survey, where we've seen the higher unemployment rates, for example, for diverse populations, and we've seen the impact, if you will, not being felt the same way across all population groups within Canada. I think that the slide itself speaks volumes. So as we've added that variable now, as we go forward, we'll be able to track the impact and to see the employment recovery as we go forward, or hopefully seeing recovery as we go forward, and be able to measure how that's affecting different groups within Canada. I think it's really important, though, to also note that diversity is felt within groups as well. So youth, for example, and women, and the experience is not the same for everyone. So having the more disaggregated information that we are able to provide, and there are limits to what we can do, the better it helps us to understand what the impact is on Canadians and how that changes over time. So really, really key addition to one of our really big flagship survey instruments.
Thank you. Yeah, so if anybody in the audience has any further question they'd like to address, we would really appreciate that. Or Mansouri, Ali, do you perhaps have any questions you would like to bring up? Oh, okay, so somebody is commenting here or asking, maybe this chart could include the impact on Indigenous communities as well. Lynn, so the slide that we just saw spoke to different communities such as the Black community or the Asian community, but not on Indigenous communities. Can you put that into context for us a little bit?
I can, thank you. We do gather information for Indigenous communities living off reserve through the labor force survey. And what we did see in our August release, what we've been doing is looking at where we were prior to the COVID pandemic shutdown. So what was employment? What did it look like there? What were the levels of employment? And then with each passing month, what's happening since that time? And we're sort of looking to see how, for which groups and for what period of time are we getting closer to where we were pre-COVID COVID shutdown. So in August, for example, for employment among Indigenous peoples, they had reached 91.4%, so about 91% of where they were in February. But that compares to almost just shy of 97% for those who were non-Indigenous. So we do have some information that at that time pointed to the fact that the recovery to that point was slower, if you will, for our Indigenous peoples off reserve. And we'll continue to track that.
Yeah. Cheryl, do you perhaps also want to speak to that, sort of the experience of the Indigenous community in comparison to, for instance, the unemployment rates of other minority groups that we are looking at?
Well, until today, I wasn't really sure where things stood. I will say that there's been a lot of sort of stories in the news about people being unwilling to get off CERB because it's there, and so why get back into the labor force? And certainly one of the factors that we were seeing in our communities was how you need an income to have a job. So transportation to your job, like lunch while you're at your job, The risk that you're putting yourself in whatever labor market you fit into was a factor. And so decisions weren't quick to be made based on some of those factors. So it wasn't about people's unwillingness to get back into the labor force as much as it was about being safe in doing so, having the resources to be able to participate in that labor force. And those were the factors that we were hearing about from the folks that we were meeting with. We do have 3 employment programs here at Bent-Arrow, and so we have a pretty good grasp on, you know, who is looking for work and what kinds of, there were certain parts of the labor force that have the compensation and benefits that made it very attractive for them to get back into the workforce. Daycares not being open was another factor. So there was just a lot going on, and it wasn't about sort of the narrative some people wanted to spin around. It was easy to sit at home and collect CERB. And that certainly wasn't our experience with the folks that we were serving who were interested in getting back, but we're taking into factor many different factors in that.
Thank you, Cheryl. All right, I would say let's wrap it up for today. Thank you both, Cheryl and Lynn, so much for taking the time to being part of this conversation today. You both brought incredible insights to the conversation. So thank you very much for that. And thank you also to our audience for taking the time to join our conversation today. Again, I'd like to invite you to complete the feedback form, please, because it will help us to tailor and improve our conversations for the future. And we would welcome also any kind of suggestions or recommendations by email, of course, as well. So thank you both so much, Cheryl and Lynn. And do you have any closing comments, perhaps?
No, I just want to say thanks for having me. I think the interface between the whole data and the stories about what was happening in our communities, I think that was pretty brilliant to bring those two things together. And they certainly do tell a more contextualized story for sure. So thanks for having me.
Thank you for being here.
And thank you as well, Miriam. And I truly enjoyed the conversation. I learned a lot today, and I'd like to thank Cheryl as well for sharing the stories. These are so important to hear. Thank you all, and I appreciate the opportunity.
Thank you very much. And yeah, we wish everybody a healthy and happy rest of the day. Thank you all very much. Bye-bye.